We all want to look and feel our best, and there is a place to come to that lets us feel that way, and pretty quickly. Greenspring Medical Aesthetics, and this is where we are today. And we're going to walk you through a procedure that you might be interested in, and we explain what it is. I'm sure you will be. Dr. Cadu is joining us right now. It's great to see you again, Doctor, as well as Dr. Nichols. And Jessica is going to be our patient today. We're going to be doing a treatment with Kybella, and that's going to be helping out with the chin area. I think a woman's profile is so beautiful, and so when we see ourselves in pictures, it may not be exactly what we want it to be. So how does this help women who are concerned about that?
Well, what Kybella will do is permanently reduce the fat under the chin especially, but also jowls in a man or woman. A lot of men are very concerned about the fat on their neck. And Dr. Nichols previously did a very comprehensive evaluation with Jess, and Jess expressed that this was really bothering her. And it's a familial trait. It's nothing she's doing wrong. Jess is an athlete. She eats properly, has a healthy lifestyle. But the fat wants to be in certain areas, and in some people, this is one of them. So Dr. Nichols has assessed her just before this. She's put marks that will guide her treatment. Jess will need to come back several times, about once every 6 weeks, and probably after about 4 treatments, this will be gone, and she'll have a nice, sharply defined jawline that does look beautiful.
It does make a difference. Then we can confidently put our hair back and feel like we have that beautifully sculpted chin area.
That's right.
And you know, with men too, I noticed that it tends to kind of drag the face down, I guess in both sexes, but especially with men, I think it ages them. So not a lot of men are familiar with this, but let's start walking through the process of what Dr. Nichols is going to be doing.
Got it. Well, Denise is going to be assisting Dr. Nichols. As I say, Dr. Nichols has expertly pre-marked, so she knows exactly how to guide her treatment. And she will sculpt the chin and neck area by selectively removing fat where it is interfering with that beautifully sculpted jawline. It'll be done with these very fine needles. The needles you barely feel the puncture, but you will feel a burning sensation after the administration of the medication. So we'll get going.
Okay. Yeah. But all worth it, right, Jessica?
That's all worth it.
Now, go ahead, please, doctor.
The medication being injected is called Kybella. That's a brand name for a chemical called deoxycholic acid, which sounds terrible, and it is a little caustic, but it's in our bodies right now. It's actually a bile salt. So our liver makes it. That's not where this material comes from. This is manufactured synthetically, but it happens to be a natural product. And every time Dr. Nichols injects a little bit in each injection site, just the right amount in each site, that is right now permanently destroying a portion of the fat in that area.
Okay, so it's not gradual, it's happening right now.
It's happening right now. Now what will happen is that Jess will have some swelling and possibly some bruising, and that may last a week or 2. So most people don't mind, they go to work, they don't care. A lot of times it's not that visible, but people feel it. So Jess will feel a heaviness, a fullness of edema or fluid in that area for a week or 2.
Now, when can she come back and have it done again?
We like to wait a minimum of 6 weeks between treatments. We just feel that that will optimize the result. Coming sooner than every 6 weeks could result in treating edema fluid rather than fat.
And how long does this procedure take?
Well, you'll see right now, because Dr. Nichols is just about done, so it takes minutes.
Wow.
And we've taken photos of Jess beforehand. Dr. Nichols carefully took before photos so we can help Jess and help ourselves remember the progress that she's making as she continues her rejuvenation.
This is relatively new?
This is relatively new, a couple of years, maybe 3-4 years. There was an off-label brand that's been around for longer than that, but a specific company, very prominent in the aesthetic industry, made this and has really made it available widely.
Now, you're going to not like me for asking this, and you're probably going to say it differs, but is this one of your favorite procedures in terms of seeing results?
It is. It is not necessarily my favorite procedure in performing it, but the results are so gratifying that I look forward to it. So Jess, you've had your first Kybella treatment. Congratulations.
Thank you.
How does it feel now?
It stings a little bit sore, but honestly, not any intense pain. I would say 2 out of 10.
2 out of 10. That's not too bad for the benefits you're going to get.
Right.
Worth it.
And as Dr. Nichols mentioned, in about 5 minutes or so, this is going to dissipate and you'll be ever more comfortable. And it's very important that you have had this done by a true expert, because the Kybella does need to be administered at the right tissue depth, the right amount, and in the right location to get a beautifully sculpted and smooth area. We don't want to inject too deep or too superficially because there can be complications. And Dr. Nichols here is as good as he gets at this procedure.
And for a free complimentary consultation, or if you're curious about the procedures done by Dr. Cadu or Dr. Nichols, you can check out one of their 2 Greenspring Medical Aesthetics locations. You can call them at 520-628-8500, or you can simply visit greenspringaesthetics.com.
And we're moving swiftly on here to some buzz topics, the most trending things that are going on right now. And of course, the one everyone's talking about is Mr. Rogers, the movie. Well, that's not the title. The title is Beautiful Day in the Neighborhood, and of course, played by Tom Hanks.
Which, you know, when we were talking about this off camera, you were like, I just still, can I say this on camera now?
Absolutely.
You're like, I just still see Tom Hanks. I don't see Mr. Rogers.
Yes.
But in every other role that he has played, I don't see Tom Hanks, but I see what you're talking about here.
It's a little more obvious.
Such an iconic person, but I saw some of the trailer of a different movie or the documentary.
Yes.
I was crying within 3 seconds.
Absolutely. He's just such an inspirational person, and of course it follows the story of a jaded and cynical journalist who was assigned to write about Mr. Rogers, and it softened him throughout the process. Mr. Rogers was just so sweet. So this is going to hit theaters November 22nd. I think it's going to do really well.
And I think it's going to be a really emotional movie, so you're going to have to be prepared to go, right?
The tissues, 100%.
So you have to go home and watch a comedy after you see something like this.
Exactly.
Well, Beverly Hills 90210 fans out there, you're going to know what I'm talking about when I say the Peach Pit. Well, the Peach Pit restaurant is opening temporarily in Los Angeles. Alex, the Peach Pit was where all the kids went after school and hung out. It's the place to be.
Yeah.
But it was just in the show.
It was just in the show. I did watch pieces of this show, I think, but the Peach Pit to me didn't mean much. So it's good to learn a little bit of the history. So yeah, it's currently sold out, unfortunately, but they said limited walk-ins are welcome. They're celebrating the reboot of the show. They'll have like diner fare. They'll have some cocktails later in the evening. So great thing for 90210 fans. And I'm surprised the show's coming back too. I hope the cast members aren't too tired, tired looking, I guess.
I mean, it's been quite a while, so maybe they're getting revamped again. I'm not sure.
I guess.
Now to get to the pet of the day, and this is a really cute one. So take a look at Max. Max holding onto his bone, falling asleep. It's so sweet. This was sent in by one of our viewers, so we just had to say thank you for this, because if you needed some cuteness for the day, there it is.
And we've had it all show with Bradley too. Talk about cuteness.
Oh yeah, up close and personal, like you've never seen before.
And send your pet to our Facebook page. We might show it here on our show. Now, is it a vacation or a necessity? Baby moons are becoming more popular than ever, and our pregnancy expert Judith Schuler is in to tell us why in just a bit. It's called acoustic wave therapy, and it's a treatment for men to treat erectile dysfunction. I have with me here patient care advisor Bill Jeffries, here to discuss. Nice to have you back here again.
Thanks, Alex.
Such a pleasure. So let's talk about how widespread ED is, because we've heard about it on the news, we see it in ads, but really how widespread and serious is it?
Statistics indicate that by the time they're in their 50s, about half of all men experience some ED issues, and the numbers rise with age up to about 70 or 80%.
Wow, so it really affects a lot of men, and it's something like we talked about before that can really take a toll on your self-confidence, on your personal life. So there's other ways to treat it too, but we're talking specifically about acoustic wave therapy, which is something that some men and their families may never have heard of. What is that?
It is something that a lot of people haven't heard of, and they're curious about. What is acoustic wave therapy? It's really kind of a revolutionary technology. It's the only thing on the market that deals with the root cause of ED as opposed to just treating symptoms. The way it works is it breaks up the blockages in the blood vessels and treats the root cause of ED, which is poor blood flow, basically.
Right, and all other treatments, I mean, they're just sort of putting a Band-Aid on the problem, right? Say like medicine, for example. Talk about how those, their effectiveness versus, say, something like acoustic wave therapy.
Sure. The popular ED drugs, Viagra, Cialis, and whatnot, deal with ED by dilating the blood vessels in order to deliver more blood flow. That's not a bad thing because that is the cause of ED is lack of blood flow. However, what a patient needs to consider is that there are side effects to the popular ED drugs to the extent that only about half the guys that need that kind of help can take those drugs either because of side effects or because of interactions with other medications that they're taking, and they do lose effectiveness over time. And
testosterone therapy, I know, has been used in conjunction with acoustic wave therapy, right?
It has. There's a common misperception about testosterone that low testosterone causes ED. That's actually not true. Testosterone has to do more with libido, and low libido can affect ED, but it's not the cause of ED. So if a guy has low testosterone levels, that's a separate issue that we need to address, but all the testosterone in the world is not going to fix an ED problem.
Right. It's about, taking care of sort of the whole picture, right? If there is a testosterone problem, then you guys can help solve that as well. And so, this is something that can be nerve-wracking for people to go into an office like this, discuss these issues with professionals. What can a guy expect when they visit your office?
Well, there's a stigma associated with ED. People don't like to talk about it, and so consequently we try to make our patients feel very comfortable. We have an all-male staff. We're not like a general doctor's office. All we do is treat ED. That's what we do all day, every day. We create a comfortable environment for men to come in and get the help that they need with their ED. We're professionals, we're experts at what we do, and we strive to make our patients feel comfortable.
You're their best friend. I mean, you're going to help them regain this part of their life that they might be missing, that will really sort of bring back a lot of that confidence that we've been talking about. And so it's a series of in-office treatments. About how long does it take, how many treatments, etc.?
Sure. The in-office treatments last 20 to 30 minutes, a couple times a week. Men start to experience benefits from the treatment as early as a few treatments, and sometimes with more profound cases of ED, it might take months. The good news is we can fix the problem.
Right. That's music to a lot of people's ears, I'm sure, struggling through it. So how does somebody know that this is right for them? Do they need, say, a doctor referral?
No referral needed.
Okay.
The process starts with a visit to our office, an exam and consultation with our in-house physician, who will do a physical exam and a health history and determine if this is the right treatment for a patient, and then make recommendations going forward.
Yeah, excellent. And so, in 30 seconds or so, if someone has been on the fence about addressing this issue, what would you tell them to sort of take control, take notice, and come in and see you guys now and start the process?
Get educated. That's the big thing. There is a lot of material on our website, links to medical studies from around the world that talk about the effectiveness of acoustic wave therapy. And that would be my advice. Get educated about it and give us a call. We're happy to talk about it.
It's great advice, and there's a great offer too for the initial consultation, which I'll give them here today. But Bill Jeffries, as always, thanks for being here.
Thank you for having me.
All right, guys, right now, like I said, there's a special offer. You can get $100 off your initial consultation if you mention the Morning Blend. If you want more information, visit flagstonemedical.com or call 520-600-4405.
It is not a honeymoon, it is a baby moon, and for some, the baby moon may sound the most important of the two. The answer as to why is our pregnancy expert, Judith Schuler, who is joining us again with always really great information. So let's talk about baby moons. We've heard about these for a while, but you think these are really important.
Well, a baby moon is actually just a trip that a couple takes before baby is born. And it's a time to kind of get away, maybe reconnect, relax, just kind of get out of your regular routine. And I think it's important for a couple before, as you know and I know, your life is going to change completely. You don't go from being a couple and just having, you know, adding one person, you're adding a baby, which
Yes.
means there's going to be a lot more taken, you know, time and effort. And so now it's the time before baby comes to relax and enjoy yourselves.
Yes, well, especially I think because nobody knows what to expect, and every baby is different. So you
That's
can
right.
plan and plan, but you really don't know what's going to happen.
You don't, and it's something that you can at this point plan on,
right.
and you look forward to. And especially in the summertime, I was pregnant in the summer, and going away someplace where you can relax and have a
Yes.
good time and sit by the pool, or
Right.
or lie in bed
Right,
and have
yes.
somebody bring you breakfast.
Exactly, rather than like stand in the kitchen with the refrigerator open, just trying to cool off when you're pregnant. So what kind of trips can couples take, and what can they do?
Well, there's a lot of things you can do. I would say don't make it elaborate. Do it like a weekend or a long weekend, you know, 2 or 3 days. There's so many places around Tucson. A lot of resorts have baby moon packages.
Do they?
They do. And so you could go to a resort or a hotel. You could stay here in town. You could go to Phoenix, Sedona. I just saw that one of the TV stars, Christina Anstad, went up to Sedona for her baby moon.
Oh, that's
and,
perfect.
Or you could go
So
to
relaxing.
Flagstaff,
That's the place.
or even someplace cool like San Diego. And you can go to a hotel. You can go someplace that maybe family has a wonderful place that you can go. And if you really like the outdoors, you might try glamping.
Glamping,
Yes.
the newest thing to do.
That's right.
Yes.
You might get rent an RV and take that someplace cool.
And
Up the White
quiet.
Mountains and quiet, and you can just enjoy where you are. And the thing about being in an RV instead of a tent
Right.
is you have a bathroom and you have a bed.
Yes.
So those are things that are important.
Yeah, and you know, if you're a family member watching right now, it's like chip in, maybe, you know, get this as a present for
Right.
your daughter or your daughter-in-law.
Right, and if you have a place that Mount Lemon or someplace up in the White Mountains, that might be a good thing. One thing we do want you to if you're considering a baby moon, check it out with your doctor first.
Oh, good idea.
There may be reasons that he or she doesn't want you to travel.
Right.
But the thing is to make it